Hey everyone, today we are going to be going over the treatment and management of diabetic neuropathy. We're going to be covering the principles of therapy, the prevention, non pharmacological treatment, and pharmacological treatment. So let's get into it. The goals in managing diabetic neuropathy isn't just about pain control. We also need to think about slowing the disease progression, reducing complications like ulcers and falls, and overall improving mobility, quality of sleep, and quality of life itself. When choosing a treatment plan, we need to think beyond efficacy. We need to think about any comorbidities, side effects, cost, and what the patient prefers. Now that we've covered the core principles of therapy, let's head to the clinic and have a chat with Mr. Anthony, a patient with type 2 diabetes. Good
Hello.
morning, Mr. Anthony.
Good morning.
Have a seat. Okay, so let's talk about something really important.
Yeah.
Yeah, how we can prevent, like, since you have diabetes, how we can prevent diabetic nerve damage from getting any worse.
Yeah. Actually, my feet have been feeling weird lately.
Mhm. That's a pretty common early sign. Good news is there's a lot we can do about it. First things first, we'll start screening you for neuropathy every year now that you have type 2 diabetes. It helps us catch things before it becomes more serious.
Okay. I can do that.
Okay. So we're going to work on a few lifestyle changes as well. For starters, a low calorie diet.
No more burger.
Maybe just once in a while and like a smaller one.
Okay.
Yeah.
Okay. I
Yeah.
can do that.
Okay. So next exercise, studies show that around 150 minutes of like vigorous exercise a week, plus some resistance exercise, mean like lifting some weights 2 to 3 times a week, can really lower your risk.
I have not been to the gym in so long.
Well, you don't really have to be a gym guy. Like some brisk walking, climbing up and down stairs, or light home exercises can work perfectly fine.
Okay.
Okay. And if you're overweight, which I don't think you are, we can aim for some gradual weight loss as well. Even a 5 to 10% reduction can help. In some cases, we would suggest bariatric surgery, but that's usually not needed if lifestyle changes are enough.
Okay.
About alcohol, it's best to keep it to moderate amounts. And if you smoke,
Actually, I know. I'm trying to quit smoking. I'm
oh,
trying to.
oh,
So
that's great. Smoking makes neuropathy worse, so quitting will make your nerves heal faster.
yeah.
Okay. Now, here's a big one, your blood sugar levels. We'll work together to keep your glucose levels stable. You can monitor them with devices like these,
Yeah.
like finger stick glucose monitors, and also continuous glucose monitors, which you can have on you at all times. All right?
Yeah.
Okay. And um, like you should be taking medications to keep it within safe levels. All right?
Even if I'm taking the medications, my blood glucose just seems to spike a lot.
Oh, well, it's normal at first. So we can change your treatment regimen a little bit. So by optimizing your sugar levels, we should be able to like, decrease your risk by around 5 to 9%. Keeping your blood pressure and cholesterol in check is also crucial. In type 2 diabetes, this can delay progression, and in type 1, slow the onset of nerve damage.
Yeah, I am taking medication for blood pressure. Should I try to adjust it?
Well, let's review your meds next visit and adjust only if needed. The goal is consistent control numbers. All right?
Okay.
Okay. Lastly, and very importantly, your feet. From now on, we'll check them thoroughly at least once a year, and I also want you to inspect them daily at home.
I mean, I'll try to, but I'm not sure what I'm looking for exactly.
Um, well, as for what to look for, right? So, what you can look for is cracks like these, right? You can look for redness between toes, any thick calluses, or honestly anything unusual like ulcers, so anything like that. Okay.
Okay.
Okay. Then you should also not be wearing like barefoot at home. You should wear socks, and you shouldn't wear open toe shoes either. It's
Hmm.
best if you wear closed toe ones.
Okay.
Okay, all right. And if you notice anything unusual, you should tell me right away. Okay, prevention is key.
I'll let you know as soon as I can.
And for patients with higher risk, those with foot deformities, poor circulation, or past ulcers, we recommend special therapeutic footwear, uh, like these shoes, like these.
Oh, that's a really nice shoe.
In addition to what we've already talked about in our conversation with Mr. Anthony, there's a couple other things we can do. You shouldn't DIY your nails or calluses, always refer to a healthcare provider. For ulcers, you can manage them by offloading, wound debridement, and wound dressing. If there's less than 50% healing in 4 weeks, then it's time to escalate care. For autonomic issues, treatment varies by system. You should always do a full review of your current medications and avoid or replace with alternatives to stop the symptoms. For gastroparesis, you can also go with low fat, low fiber meals. For orthostatic hypotension, you can wear compressive garments and increase your physical activity. Now for the meds, let's start with the first line agents. First of all, gabapentinoids. Uh, like Gabapentinoids like pregabalin and gabapentin are great for neuropathic pain. Pregabalin is usually more preferred because it's more pharmacokinetically predictable. It works faster and less adjusting is needed and can also be taken twice daily. But gabapentin is cheaper. These drugs are anticholinergics. They work by blocking presynaptic alpha 2 delta subunits on voltage gated calcium channels in the dorsal root ganglia, and this results in analgesia. The pain modulatory effect is due to the presynaptic inhibition of these things, glutamate, substance P, and calcitonin gene related peptide. Just keep an eye on patients with heart, kidney, or liver issues because this can cause peripheral edema. Next, we have SNRs, which are serotonin and norepinephrine reuptake inhibitors. And like the name suggests, these drugs cause highly specific inhibition of reuptake of serotonin and norepinephrine. So there's a high availability of these neurotransmitters at the synapse. The drugs in this class are duloxetine and venlafaxine. Duloxetine is safe and well tolerated. Venlafaxine is an alternative to this drug in the treatment of painful diabetic peripheral neuropathy. They are especially useful if the patient has trouble sleeping or depression. Moving on, we have tricyclic antidepressants. The drugs in this class are amitriptyline and nortriptyline. So what these drugs do are they inhibit norepinephrine and serotonin reuptake at synapses of central descending pain control systems, and also cause antagonism at NDMA receptors. This can be beneficial for patients with insomnia and depression because these are common comorbidities in the neuropathic pain patients. If you need a baseline, you need a baseline echo if the patient is over 40, and you have to avoid these drugs in patients with a cardiac history. And lastly here, we have sodium channel blockers like carbamazepine, lamotrigine, and valproic acid. It's important to note that you have to avoid valproic acid in women of childbearing potential. There are also several second-line treatment options available. Feel free to pause the video and take a closer look at the table on screen. Don't forget neurotropic B vitamins like vitamin B1, B6, and B12. They promote myelin growth and repair and also reduce neuropathic pain. Vitamin B12 in particular is recommended for patients with metformin treated diabetes mellitus with also vitamin B12 deficiency and peripheral neuropathy. They're indicated in patients with sensory peripheral neuropathy resulting from metabolic diseases, medication or drug use, nutritional deficiency, and other causes. These vitamins can also be given as prophylaxis in patients with high risk of developing peripheral neuropathy or as a treatment to prevent progression of peripheral neuropathy. So finally, for autonomic complications, specific drugs are used depending on the problem. I'll just flash those quickly here. That wraps up treatment and management of diabetic neuropathy. In this video, we've discussed the prevention, non-pharmacological management, and pharmacological management of this disease. So thank you so much for tuning in, and let's keep learning together.